my work family knows that my mother unfortunately suffered a heart attack and was hospitalized on Saturday. And fortunately, because of the great care of our hospital system, she's doing well now. She's stable, but it was incredibly scary. And I want to share with folks why vaccinations are so important. Because the hospital that she was first sent to, Holy Cross in Germantown, was overwhelmed. And as I talked with the hospital staff there were so many things that they were trying to do to handle the critically ill, like my mother, in addition to those unvaccinated, majority, who had COVID. And I talked to many of the doctors and nurses throughout the day as I sat there in a waiting room. And I also talked to family members of people who were unvaccinated. And the same stress and fear and worry that I had for my mom was the same exact thing that they were experiencing. So I have a personal plea to all those who are unvaccinated who think that, I can handle this on my own. The reality is that think about someone else besides just yourself. Think about your family and friends and how they're going to sit there in that waiting room and hope and pray that you make it, that you live. Because that's what I was doing for my mother. And I was also concerned about the fact of how they were both competing for the same space. And so there's so many critically ill patients that will go into our hospitals who will need that space also. And so we don't want to take up those spaces with people who can actually prevent being in the hospital in the first place. So I beg of you, please, if you're not doing it for yourself, do understand that there are other people out there who are going to have issues that are going to need to use that hospital space. If you can't do it for yourself, do it for them. And if you can't do it for them, do it for your family and friends who are also going to be sitting there in the waiting room, praying in prayer circles, talking about the memories that they have of you, hoping that they'll still have additional memories of you, that they'll be able to live with you and make. Because I talked with those families. As I sat in the hospital for 2 days, we all start to talk to each other about what's going on. And I talked to families of those who had done everything they possibly could to try and encourage their family members to get vaccinated. And they refused. And now here they are fighting for their lives. And if you don't do it for them, then please do it for our hospital workers, our doctors and nurses. Because as I found out about my mother and was in the hospital with her, I found out that my mother-in-law, who is a nurse at Holy Cross Silver Spring, contracted COVID and had COVID and pneumonia, who was also vaccinated and boosted. So even though she was vaccinated and boosted, she still got COVID and had it seriously enough so that she actually developed pneumonia. And fortunately, she is also now stable. However, I say to you, our healthcare workers on the front line are fighting each and every day to protect and care for those of you that are sick. And they're putting themselves and their lives on the line. I've talked about this before, about how my mother-in-law, along with all of our healthcare workers, has always been on the front lines, caring for those as we set up the tents when we first found out about COVID and had the tent set up outside. She was out there testing people, trying to make sure that people were safe. She was caring for people who she didn't know, because that's what she said that she was going to do. And so many doctors and other nursing professionals and staff that are in these hospitals are doing the same exact thing. So I ask you, if not for you, do it for the people that would be sacrificing themselves for you. It's not too much to ask. It's not. And so I really want to just say thank you to all of the professionals that cared for my mother and my mother-in-law. It was an incredibly traumatic weekend for me, but one that was eye-opening as to exactly why we need to make sure that we continue to press for vaccinations. The unvaccinated are 9 times more likely to enter our hospital system. And those beds and those resources are precious. Keep in mind, it's not just about the beds. The time that they spend, the nurses told me, the time that they spend with a patient that's unvaccinated and the procedures that they have to go through because they know that now this person is COVID positive requires more time and more effort to try and ensure that they themselves don't get sick. And those precious time and resources are ones that are then diverted from other patients who also need that attention. This is real. I've seen it at 2 hospitals, at Holy Cross in Germantown and at Washington Adventist. And all of the stories are the same. We can change this by making sure that we continue to push for vaccinations for everyone. Set aside your political debates. Let's do this for us as people, as a society. Thank you, Mr. President.